As you know, there are many advances in managing multiple myeloma patients, technologies, treatments, but we know that the access for all of these treatments is not the same in the global, and particularly in low and middle income countries, we have some limitations to access. So much more than limitations for access, we have patients, for example, in Latin America, we have patients that receive treatment in the private sector and the patients receiving treatment in the public sector. Particularly in Brazil, 75% of the patients, they receive treatment in public institutions and 25% in private institutions. And we have many drugs approved in Brazil, including the bispecifics and the cilta-cel. But the public institution, there is no, they don't have access for the best treatment for the new drugs. So we have only, I think it's a good drug, but not the new drugs, you know. So, of course, we have many protocols, good protocols, guidelines for private patients, but for public institutions, we don't have a very advanced treatment. So I can show, and we have data comparing this overall survival from patients at the private sector and the public sector. And unfortunately, the overall survival for patients in public institutions are inferior than the patients in private. This is unfair, but I think we have now, for all of the world, in fact, we have to discuss much more the cost of the treatment and the access, because I think we have to treat our patients in the best way, with the best drugs, with the best results.